It doesn't matter what my numbers are, it just keeps getting worse. A patient named Susan said that to me, and honestly, it stopped me in my tracks. Because she's right. For a lot of people, the numbers do look fine. A1C is acceptable. Fasting glucose is in range. Your doctor looks at the chart, nods, and says, keep doing what you're doing. But something feels off. You're more tired than you should be. Your body aches in ways it didn't used to. You wake up feeling like you're barely even slept. And there's the quiet voice in your back of your mind saying, something's wrong here. If that's you, if you've been sitting in that doctor's office, hearing your labs look fine while your body is screaming otherwise, I need you to know you're not imagining this. I'm Dr. Jason Schumard, and I've spent years helping thousands of type 2 diabetics get off medications and actually reverse their condition using functional medicine. And here's what I've learned that most doctors will never tell you. Your standard labs, they're only showing you part of the picture, sometimes a very small part. Here's what's really going on. Most primary care doctors run the most basic tests, fasting glucose, A1C, maybe a basic metabolic panel. And look, those tests aren't useless, but they're designed to catch problems after they've already become serious. They're not designed to catch what's brewing underneath, the slow, silent damage that's happening right now while your numbers still look good and acceptable. Let me give you a few examples. Fasting insulin, most doctors only test your blood sugars, but insulin is what controls your blood sugar. You can have normal glucose while your insulin is through the roof, which means your body is working overtime just to keep you in the range. That's called insulin resistance, and it can be happening for years before A1C budges or increases. By the time your glucose looks bad, you're way further down the road than needed to be. Another one is C-reactive protein. This measures inflammation in your body, and inflammation is one of the biggest drivers of diabetes. Even drives complications, kidney stress, nerve damage, heart disease, etc. It almost never shows up in a standard panel. And then there's your liver. Your liver enzymes, especially something called GGT, can reveal early signs of fatty liver congestion and stress that directly affect how your body processes sugar. Most doctors don't run GGT. Most don't even think to look for it. And these are just 3 markers. There are several more that can reveal what's actually happening inside your body. Things that explain why you feel so off, even when your basic labs look fine. Here's the hard truth. Susan, the patient I mentioned at the start, she's a former nurse. She knows medicine. She's been through 2 cardiac ablations. She's been through 2 cardiac ablations, a defibrillator, and kidney episodes that landed her in the hospital. Her A1C looked okay. She was off insulin, but her organs were still declining. Her kidneys were still under stress. Her body was still breaking down because nobody was looking at the root. They were just managing the numbers. And that's the trap so many type 2 diabetics fall into. You can have acceptable labs while the disease quietly progresses underneath. But here's what gives me hope. When we finally run all the right tests, when we look at the insulin inflammation, liver function, toxins, gut health, we often find answers, real answers, things that we can actually address. I've seen patients who felt like they were running out of time finally understand what is happening inside their body. And when we address those root causes, things start to shift. Not overnight, but real measurable change. The kind of change that doesn't just show up when you're all done chasing your A1C. So if your labs look fine, but something feels very wrong, if you're tired of hearing you're doing great when you know in your gut that you're not, I put together a special training that explains everything what's happening inside your body and what your doctor probably isn't testing for. No fluff, no scare tactics, just the truth about what's really going on and what you can actually do about it. All you have to do is click the video right here and go and watch it right now because you deserve answers that match how you actually feel. I'll see you there.